opportunity for us as PF Warriors, and his name is David Junga. And David is which is kind of unique here. He's a registered respiratory therapist, and that's meaningful for us because there's a lot of people out there talking about pulmonary fibrosis or COPD or asthma or other lung diseases. And here's David, who's a registered pulmonary therapist, and he's been involved over the years. I'm going to take a second here to make sure we have everybody in our room. David has founded, his resume is like a shopping list of excellence because he not only is the program director in his organization, his company, but he's created and directed programs in pulmonary rehabilitation, lung cancer rehabilitation, pediatric asthma, medically supervised exercise classes, corporate wellness programs, and the list goes on and on. And David, I have to tell you, I'm thrilled to have you here. It's a rare opportunity for us as PF Warriors to have somebody with your credentials and background. And I want to thank you so much for taking your time and sharing with us how to live well and live better in spite of having a lung disease. So let me introduce you, David Junga.
Hello, everybody. Good morning. How are you?
Good morning.
Excellent. Bill, thank you so much for the kind words and the wonderful introduction. And I'm honored to be able to be here and to try to answer questions and try to offer some help for people, especially because we're all at home. I'm in Connecticut. I don't know where everybody else is, but pretty much it's a national quarantine at this point. And because of things like that, it's rather difficult because people can't do things. So we have to try to
David, I'm sorry. I apologize. I had to mute everybody except you are now unmuted. I apologize. Somebody was coughing,
Okay.
and I would ask anybody. I forgot to even mention housekeeping, and excuse me for interrupting. But
That's okay.
please, if you would, please turn off your microphones. You'll have an opportunity to ask and talk and ask questions to David. But for the time being, until we kind of get there, if you turn off your microphones, it'll avoid having coughing and shifting back and forth on the speaker. Just takes a moment. On the bottom left-hand corner of your screen, you'll see where it says mute. If you press that mute button, if you want to talk, you can turn it back on again, or you can press your space bar. As long as you have your space bar pressed, you can talk. There's other buttons on that bottom just to look at for a moment. One of them is you can turn your video on or off. Example, I see Peggy Marshall as an example. She's either coming in from a telephone or she has her video off, which is fine. But when you're asking questions, I'd encourage you to turn your video on so we have more of a kind of a personal dynamic relationship. And with that, David, I'm sorry to interrupt, but I had to get that housekeeping out of the way.
Thank you. I'm so glad you did because I'm not that familiar using it with multitudes of people. Usually what I do is one-on-one or just a small staff meeting with, 6 people, 8 people. But anyway, good morning, everybody. My name is David Junga. I am the program director of Pulmonary Rehab Associates in Connecticut. I'm also not only a nationally board certified registered respiratory therapist, I'm also a certified postural specialist. So I deal with chronic pain, I deal with posture. And what I found over the years is the impact and the direct correlation between posture and our breathing. So I'm going to share some of that with you today. And like I said earlier, I don't know if you heard me if I cut out, but one of the things now during quarantine is people really can't get out. So one of the things I want to do is give you some exercises later on during the talk to go over that you could do at home. Because movement and exercise, and no matter where you are physically, any movement is going to be good as long as it's being controlled and as long as your oxygen levels are being checked and your heart rate. So I'm going to go over some easy ones that you can follow at home, but we're going to go through that in a little while. So who am I? And how the heck did I get into this? Well, first of all, I have asthma. And so when I was going back to school, I wanted to do something that really identified with me. And initially I was going to school for physical therapy, but I just didn't feel aligned with it. I liked the concept of helping people. I liked the concept of what it was doing, but it wasn't very specific to me. And I ended up talking to somebody who was a respiratory therapist, and they said, hey, why don't you just shadow me for the day? So I did, and I fell in love with it. And I absolutely am extremely passionate about this from a personal level as well as a professional level. And so I worked in the hospitals for about 6 years, trained in every aspect from, you hear about all these ventilators. The people who are managing the ventilators now are respiratory therapists. So I used to work trained in intensive care units, managing ventilated patients, emergency medicine, neonatology with newborn babies, pediatrics. So I have a pretty diverse background working in a hospital setting. And then adjunctly to working in a hospital, I was working also in a nursing home. I was moonlighting in a nursing home. And so I kept seeing all these people sitting around and not moving. And I kept thinking, when I sit around and I don't move and I'm working in the house all the time, I really get stiff. It's kind of depressing. I said, I normally feel so much better after I go for a walk or go for a run. So basically, I went up to these people and I said, hey, come on, let's try to go for a walk. No one wanted to walk. So I said, next door is a donut shop. Let me see if I can go and entice these people with a donut. So I came back with a dozen donuts and I said, hey, does anybody want to walk? Everybody said no. I said, if you walk, I'll give you a donut. So the next thing you know, they said, okay, give me a donut. I said, no, you have to walk first. Even if it's 2 steps, it doesn't matter. Even if you can stand. And if you can't stand, if you can move your legs, you'll get a donut. So it worked. And pretty soon I'm coming into work and people are saying to me, hey, you the guy with the donuts? We want to walk with you today. We want to exercise with you today. And that's how I got into this. And then I went to the head of the nursing program over there and said, hey, give me your people that keep leaving the nursing home and going to the hospital. Let me see what I could do to get them better and see if we could avoid hospitalizations. And we did. And that's how I started doing this. And then one of the patients was leaving to go home. And she said, could you please come to my home? I don't want to go back to the hospital. So I said, sure. So then she started telling people, and how I started this practice was I used to make house calls. And so I would go to everywhere, but then the geographic area got so big. And if anybody knows Connecticut, the traffic along I-95 is just horrendous. So I said, well, let me open an office and it would be easier for me and easier for the people because then I can help more people. Bill, is there any way that I could get myself, because I'm looking at other people in the big box on the bottom. Let's see. Okay. Okay.
You can go to gallery view. Up in the upper right, there should be something that might look like a Rubik's Cube.
Yes.
That should give you gallery view.
Okay. Yeah, there we go. Okay, good. Thank you very much. I appreciate that. Thank you. Okay. So basically, once that started happening, then I opened an office, and that's how the practice began. And it was a very fascinating way of learning. Initially, it was good because I was able to see what people were doing in their homes. I was able to see what they had to work with. And when I started this practice, when you go to our office, there's not a lot of equipment in there because of the fact that if you can't replicate it at home, then what's the point? It's supposed to be something where you could be able to do it at home. So what you do at home plus what you do with us is your total result. So that's what we're working on. So what is pulmonary rehab? For people who don't know, I'm going to share my screen because one of the things that we have, let's see, hold on one second. And here we go. Okay. Good. All right. So let's go back to this and let's share the screen. Okay. Can everybody see that?
Looks good.
Is the bottom part cutting out, or is it okay?
A little bit,
Bottom
but you can
part,
make that window larger and see the whole thing, David. There you
Okay.
go.
that's good.
Is that better?
Yes.
Okay, great. So basically, this gives you a visualization of what the current treatment model is. And the current treatment model for pulmonary patients is decreased activity level and weakness, anxiety, depression, and a lot of decreased quality of life because you can't do the things that you would like to do. So you get put on meds. And then after a while, they a lot of times they don't prescribe exercise as a huge benefit to this. And then because of that, people physically decline. And then they increase the dosage of the meds. And they still physically decline because they can't breathe, so they can't really do a lot of exercise. And then prednisone, and then oxygen, and then more physical decline, and then increased oxygen. And a lot of that is because of lack of proper exercise. And then at the last portion of that, it just creates this vicious cycle of weakened muscles, weakened immune system, pulmonary infections, hospitalization, nursing home, back home, and then that lack of exercise. So the key is the exercise. But when you introduce pulmonary rehab, then now we're getting increased activity levels, increased physical strength and purpose, and improved quality of life. And the goal of that is to be able to use your prescribed meds and oxygen with a plan, hopefully, if you can, if you get stronger, to lower the dosage to whatever the minimal amount that you need. Proper breathing techniques, upper and lower body strengthening, diaphragmatic and respiratory muscle strengthening, walking, stair climbing, education, nutrition, and then that will lead to a lot more continued independent exercise. And because the three things that naturally boost your immune system are rest, exercise, and nutrition. And that's very important. Does anybody have any questions? Or do you want me to leave this on the screen a little bit longer?
If people want to ask questions, David, they can press their space bar and they can
Okay.
ask you a question.
Would you like me to leave this up a little longer? Or? Okay.
David,
Yes.
how do the doctors and the people in hospitals do they accept this chart and their predilection to make it worse, or do they accept it as being probably right? How do your other professionals look at this chart?
That's a very good question.
Yeah, it's kind of damning to those who are prescribing prednisone, et cetera, and seeing the patients come back over and over again in the hospital.
Yeah, and I mean, that's an excellent question. Unfortunately, this is the reality. I mean, I've been doing this for 20 years, and this is the reality of a lot of the treatment models. And I'm not saying that this is, absolute, but this is a lot of situations when I see people that come in, they've been going to pulmonologists for years. And then they'll say, I don't understand why they didn't order pulmonary rehab or exercise or anything for me sooner. So that's how I came up with this, based on the feedback that we got from patients and the commonalities between them. Any other questions?
And many of those people in the hospitals and in the pulmonologist office change their ways, or are they just stuck in the give me I'll write a prescription and see in 4 months syndrome?
You're talking about the clinicians.
Yes.
Yes. Yeah, that's a common issue, because again, they're trained, to help with pharmaceuticals, and they're trained to do that. And this is meant to raise the awareness for having them say, look, here's another tool for your toolbox that you can help patients. And it's a very important tool. And a lot of times, if we educate the patients, then the patients can go in and ask themselves, hey, can you refer me to a pulmonary rehab program in my area? Because again, you don't know what you don't know. So we're trying to educate, and we're trying to give people the tools that they need to be able to help you. That's very important. All right, I'm going to take this one down. I'm going to show you another one that we have, which is, I'm sure everybody can relate to this one. Okay. This is another one. So a lot of times there's the shortness of breath leading to people becoming more sedentary and not moving around that much. And that leads to some anxiety and depression over the fact that, wow, I used to be able to do all this stuff and I can't. And then when you go to do these things, you say, you know what, why even bother? Because a lot of times when I do that, I'm so winded, I can't really do it. That leads you to become more sedentary. And then the muscles get much weaker. And that leads to more shortness of breath. And it just keeps going in a cycle and going in a cycle. So that's one of the other benefits of pulmonary rehab, is the goal is to break this cycle and then to empower everybody to try to break the cycle. Anybody have any questions on this?
May I just say something?
Yes.
Good afternoon. My name is Nick. I'm from Rochester in England. Good afternoon, David.
Good afternoon, Nick. Nice to meet you.
My local council, of which I'm also a member of, so that's been rather good as well. But my local council has a brilliant public health system. It's not the same for everybody in the UK. I know that from speaking to other members. I've done pulmonary rehab both last year and the year before. Very intense 6-week course, and then sent to the gym after that. And I was due to start another one around July, August. I don't know if that's going to happen now. Obviously, my going to the gym has stopped, but I am making myself do exercise at home. Well, at least I was until I fell down the stairs this afternoon, so I'm a bit shaken up.
Oh gosh, I'm so sorry.
It's been a bit of a pain, but my missus is sorting me out. So I am on everything you've mentioned. I had anxiety and depression before I had pulmonary fibrosis, so now I deal with both. I make myself do exercise. I'm trying to get my weight down because ultimately, the only thing that will help me ultimately is a lung transplant. That's what my consultant has said. I'm not at that point yet. So I was going to join your exercise program this afternoon, but I'm not feeling that way now because of my fall. I have a bike in my office. I try and do as much exercise as I can. And here's the thing. So you said about the circle. So you do the meds, they put you on oxygen. I'm on oxygen, but only for exercise when I get exhausted if I come up the stairs into my office. So I'm on oxygen, but this morning I decided I'd do some step ups. There's only one step up from my kitchen to my dining room. I did 70. I thought, wow, I've done that really well. 4 minutes and 10 seconds. I was absolutely exhausted. I'll turn my oxygen off now. I hadn't turned my oxygen on. That's why I was so exhausted. But that's a good thing. So what you're talking about is my consultant wants me to take 4 litres of oxygen if I'm walking around, which at the moment I really can't do. 6 litres of oxygen when I'm at exercise. I'm on OFEV, prednisolone, and all the other meds that go with it. I think I'm 3 years since diagnosis. I'm doing really well, but I've joined you today because I'm really encouraged. I want to see what else you can do because I do get a terrible cough. It's not there all the time, like some fibrosis patients. I get coughing fits, which can be quite nasty. I have been quite out of breath the last few days, and I am finding it really hard. I'm on my 6th week of lockdown, and I'm a person who's always out. So I'm really encouraged, and I'm looking forward to seeing what you've got to say this afternoon about what else I can do to help my breathing and the anxiety. And it's all one big mix. And I just want to encourage people that are here this afternoon that to do what you're doing. You've got to keep exercising. My consultant said last week, keeping mobile and doing what you're doing is absolutely critical because that will be one of the things we talk about should you get to the lung transplant stage, which apparently I'm nowhere near needing yet. So I just wanted to say thank you. Hello from England, and I'll shut up because I talk. But I'm looking for what you've got to say, and I'm going to try not to fall down any more stairs.
Yes, please be careful, and that goes for everybody. I know we're all stir crazy and home, and but there is so many things that you can do, and a lot of it is, you could do it with just everyday items that you have, and we're going to go over some exercises later on that you can do and you can try, and then we'll go over a little more questions and answers. I want to give you a little bit more education about a lot of times with the shortness of breath. I mean, and all pulmonary situations come down to either one of the following: either low oxygenation, so it's all oxygenation, or ventilation, or a little bit of both. So oxygenation is adequately getting oxygen into the body, and ventilation is getting rid of carbon dioxide. And a lot of times patients will say, you know, I'm wearing my oxygen, I check my number, I'm 95%, but I'm still really winded. Why? And that's because it's also a ventilation issue. And both of those will cause pulmonary related shortness of breath. And so that's what we have to work on. So if you think of your body as a car, you could have a full tank of gas, but if you plug the tailpipe with a banana, the car's not going to run. It's the same in the human body. So proper exercise will allow your body to require less oxygen and also produce less carbon dioxide, the stronger the muscles get and the more stamina and endurance that you build. And I know initially that's hard, but that's why it has to be built up in small stages. So one of the other questions that people will say is, you know, who can do this? Who can do pulmonary rehab? Who could do exercises at home? Pretty much everybody. I mean, if I have so many exercises that you can do just seated. You don't need space. You don't need a lot of equipment. You don't need anything. I mean, basically, we have a towel roll. This is what you're going to use. Nice and easy. Most importantly, you have your pulse ox, because we want to know at all times what your oxygen levels are. Does everybody have a pulse ox? Excellent. Yay, I see them now. Yeah, everybody. All right, here, let's show them. Show them up here. Everybody show me your pulse oxes. Let's see.
Mine's
there
on
we go. Let's see. All right. This is good. Hold on. I'm scrolling through all the pages. Hello, everybody. Hello. Look at these. All right. This is excellent. Okay. That is critical, because you want to know and you need to know what your oxygen levels are. Because if you start to damage, or excuse me, if you start to go low, you're going to damage the healthy remaining lung tissue that you have, and heart tissue and brain tissue. And so we want to try to avoid that at all costs. So it's very, very important. You want to check with your doctor, and you want to find out what your operating ranges are with your oxygenation. Normally we want it about 92 or higher. That way it'll allow for a dip and come back up. I don't know how it is in the UK, but normally in the United States, the Medicare requirement, I believe, is 88%. So if your saturation is 88%, then you would qualify for oxygen. Also, you want to make sure that you also look at your heart rate, because you want to say, okay, your oxygen is 95%, but if your average heart rate is 75, but now your heart rate is 95, you have to ask, why is my heart working that hard to maintain 95% saturation? So there's a lot of factors. And I suggest everybody get a notebook and keep a daily pulse ox log, not to drive yourself crazy and looking at it every 5 minutes, but just say, on average, when I get up and I do my activities, what are my numbers? In the afternoon, what are my numbers? When I exercise, what are my numbers? When I get out of the shower or I make the bed, things that you do on an everyday basis, what are my numbers? And that way you can share that number with the doctor, because again, they don't know what they don't know. And the more information that you can give them, the more opportunity there is for them to help you. And that's very important. I would even keep in that notebook, I would just create your pulmonary notebook, write down all the questions that you have for your doctor, and call ahead and just say, hey, I'm going to need a couple minutes probably because I have a lot of questions. I'm also available. I'll give you my contact information at the end, and we're going to give everybody a free consultation after this to answer your questions. But that's important, because communication is really critical, because they want to help you. And the more information you can give them, the easier you can make their job and the better that they can help you. Okay, so we talked about the equipment. You need your pulse ox. It would be good if you had a chair with no arms, because some of the upper body exercises, we don't want the arms of the chair to get in the way. Some dumbbells or some water bottles or cans of soup, whatever is easier for you. A blank wall. I'm going to show you an exercise that's going to be kind of challenging. It only takes 1 minute, and all you need is a blank wall, and you're going to feel everything in your body open up. You're going to recruit muscles that you have not felt in a long time in just 1 minute. So before we do that, one of the most important things that you need is hope and a kick butt attitude. You have to smile and say, you know what? I'm going to invest the time. I'm going to do this today. I'm going to feel good today. Plenty of water, checking your numbers, and wanting that desire to feel better. Because then you can actively participate, because there's nothing worse than sitting home and saying, you know what? This is happening to me and I can't do anything about it. I want to empower you to be able to do that. I want to give you some exercises and some knowledge in that arena to be able to do stuff. Okay? All right. Bill, what do you think? Should we demonstrate some exercises, or do you want to have a couple questions before we do it?
I think we're all chomping on the bit, David, but if anyone has a question, now's the time to ask it.
Anyone?
I have knee problems and hip problems, and I was encouraged to hear you say that a lot of these you can do without physically walking. I guess I'm more interested in something like that.
Mm-hmm. Okay, that's an excellent question. Fortunately, I am also a posture specialist. And so that really just, I mean, you know, they say man plans and God laughs. About 9 years ago, I was playing tennis and I blew out a disc in my back, and I went and looked for treatment everywhere. And the only thing that was left, because it just kept recurring, they wanted to do surgery. And I said, no way. And finally, I stumbled upon this posture therapy, and it changed my life. And I liked it so much, I went and got certified in it. And now I've incorporated it in all of our exercises, because posturally, it is so important. Because a lot of times here we are, just from a simple, I'm going to turn to the side, from a simple postural standpoint, when you're rounded, you're working on the computer, you're doing this, there's a tremendous amount of rounding here. The neck is jutting forward and your shoulders are rounding. Now, a couple of issues with that is, as soon as the shoulders start to round, you're collapsing your chest and you're squeezing on the chest wall, and it makes it much harder for the lungs to open. One of the other things is, part of the nerve flow that gets down to the diaphragms, which are your main muscles used for breathing, run all the way up into the neck. So when the neck is forward, there is a chance and a propensity that you could pinch those nerves, and that could also affect your respirations and your breathing. So proper posture is really, really important. So I'm going to go over a couple of exercises. I want everybody to just check their pulse ox, make sure that their numbers are okay. If they need to bump up, this is not going to be too aerobically demanding at all, so you don't have to worry. But I want everybody to make sure that they're in a comfortable chair, preferably with no arms. But if you are in a chair with arms, it's okay for these. We can augment that. The other thing is, can I ask everybody's permission to just lose the stethoscope in my jacket and roll up my sleeves so I can demonstrate some exercises? Is everybody okay with that?
David,
Excellent.
for most of us, putting on socks is dressing up, so please.
Okay. All right. Good. Then let me do this. Bear with me 1 second. Let me just hang up my jacket, roll up my sleeves, and we're going to do a couple exercises. For the first set of exercises, there are going to be some upper body exercises. And then for the second set, there's going to be some lower body exercises, and you will need the towel roll or a pillow, anything, or a roll of paper towels. It doesn't matter. So with the towel roll, you're going to put it out lengthwise. You're going to fold it in half again, roll it up nice and tight. That's what you have. And I have a little rubber band around it, just like this. And I'll explain that. You're going to be blown away with what you feel with that. So just give me 1 second. Bear with me. Okay, let's roll up the sleeves and get to work. Okay, So, like I was saying before about the shoulders being rounded and compressing the chest wall, one of the first exercises we're going to do is I just want you to sit, get comfortable, hands up, and you notice just the simplest little thing, just turning your hand from palms down to palms up rotates the head of your humerus right here. And what happens is part of this shoulder girdle is this clavicle right in here, and the head of the humerus in your shoulder, and then the wing, the scapula in the back. And when we can roll these back, you'll feel a big difference of opening in your chest. It leads to a lot more expansion, and it's easier. It's like basically, you know, when you get a balloon and you stretch it before you try to inflate it for the first time, that ease of stretchability in the pulmonary world is called compliance. And that's what we want to do. We want to make it easier for the lung and the chest wall to expand. So just simple positions, you know, like I said, if you're sitting on the computer all day or you're reading and you're hunched forward, your neck is forward, we want to do that. So the first one we're going to do are called shoulder rolls. So what you're going to do is palms up on your thighs, and then you're just going to take your shoulders and you're going to go up and back and down and forward. So from the side view, it's up and back and down and forward. Noticing that the palms are up and nothing else is moving. You're not rocking, because there's a lot of common compensations with this. So you just want to roll. You'll probably hear some cracking in here, and that's okay as long as there's no pain. You're just moving things, muscles, ligaments, and tendons that you haven't moved in a while. And then you're just rolling. These are reverse shoulder presses, palms up. And then after you've done, I try to do about 10 to 20 of them based on whatever you can do. Whenever you're doing any of the exercises, I want you to just ask yourself, how is your breathing? Are you winded? Do you need a little bit of time to just stop and recapture your breath? If you can, it's okay. Then the next one is going to be shoulder rolls going forward. Up and forward and down and back with the palms up. This is going to wake up the shoulder girdle. Okay? Anybody have any questions so far? We're good? Okay. Next one are shoulder squeezes, scapular contractions. So again, palms up, and you want to pinch your shoulders back. Now, what happens is everybody, including me, being an asthmatic, so I can say people with breathing problems, so I'll include myself in this, we have a tendency when we are winded, our shoulders come up. And so it's a very natural response because we're gearing up to do this work to be able to breathe. And the problem with that is when you pull up on the shoulders, you've also elevated your diaphragms and you squeeze your lungs shut. So if you can relax the shoulders, the diaphragms can now drop and your lungs have some place to expand in your chest wall. The other thing is psychologically, this creates some anxiety. When you relax your shoulders, it's been my experience with almost all the patients, as soon as they do this, it's more of a calming, relaxed effect, which is good. And that's what we want. So now with the shoulder squeezes, we want to pinch down and back, down and back. So from here, so we're not coming up, we're going down and back. And it's a very small movement, but you want to feel your shoulder blades in the back gliding and coming together and releasing. One of the other thing is, how do you breathe during these exercises? I want you to breathe in very slowly, in through your nose, just a small amount. A lot of times, you know, they used to talk about this pursed lip breathing and stuff, and they would say, smell the roses and blow out the candles. That's not even close to being how it should be, because it has to do with the flow of air. And we want it to be a nice, slow, normal amount of breath in, hold, and then slowly. And a lot of times for pulmonary fibrosis patients, if they take in a deeper breath, it's going to really lead to some coughing, and we want to avoid that. So a nice small volume of air in, hold, and then, so that's good. Now, one of the other ones that we're going to do is, if you can get your arms here, start with your arms like this, and you want to make sure you're You know, a lot of people are going to start like this. Their shoulders are going to appear. We want this to come down and relax. And then you want to gently blow, come together, and then breathe in and come back. But notice my elbow is at the same height as my shoulder. When this drops, you're really not engaging the muscles. We want to bring this up to here. So now it's blowing. Now let's say your shoulders are rounded. Your wrists are going to come together, but your elbows won't yet. So what I want you to do is just come to here and try to keep the same distance between this and this. And if you can only come to here, it's okay. Don't do that, because that's going to change the position of your shoulder. So you're going to come back, expand your chest, hold it, and then blow. And then breathe in and come back. In time, your arms are going to get tired, and you're going to slowly start to go down like this. Make sure you bring them up. Try to keep this over here. What I tell everybody is if you have a watch on, try to have your watch above the level of your eyes the whole time. So you're going like this, and then you're coming back. Good. This is called the pectoral press. So you're working on your pectoral, your chest muscles. So you're coming across, boom, and then you're coming back. Good. Okay. Now, one of the other things I want you to do, this one's going to be a little more challenging. Is everybody okay? Anybody need a minute or so? Do you want to check your numbers? Everybody check their numbers and make sure you're doing okay. Oxygen and heart rate. If you're a little winded, again, in, hold, and blow. Can I see a thumbs up for everybody who's okay? Everybody's okay? All right, so far, hold on. Bill, we good? Everybody's good? Okay. Excellent. All right, good. This next one is going to be challenging. You're going to feel this. This one is called static overhead extension. What you're going to do is you're going to cross your fingers like this. And you don't have to lock them in. You could have them open a little bit so they're like this. You're going to go like this. And then you're going to slowly start to tilt back and tilt your head back, pressing up to the ceiling, relaxing, letting everything just relax as you're pushing up. You're breathing in with the nose, blowing out softly with your lips. And then slowly come down. Anatomically, when you're forward like this, it's called flexion. And so we want to get back an extension to put your body back in a more neutral position. So that static overhead extension position will get things back. Your upper back, your shoulders, your neck, everything will come back. Everybody okay so far?
David, could you name the different exercises for us?
Yes, the very first one was just shoulder rolls backwards, shoulder rolls forwards. The second one that we did was the shoulder squeezes. So they were just going down and back from here, always palms up. The third one that we did was the pectoral press. So from here, across and touch, and breathing in, making sure that the elbow tries to stay at the same height as the shoulder. Let's say you have shoulder issues. Let's say you have a hurt rotator cuff on this side. Then that's okay if this one's down here and this one's up here. It's okay. Because as long as it's a controlled movement, all movement is good. The human body craves motion. We need to give it motion, and it's important. Okay. And then the last one was static overhead extension.
I have a question.
Yes.
About that last one.
Yes.
I have scleroderma. My fingers are contracted. I can't really bend my wrists back like that. I can't interlock my fingers. How can I adjust that movement?
You could hold on to something. If you can, can you grip something?
Yes.
Okay, then hold on to something. You could hold on to your towel roll. You could do whatever. As long as you're coming back and trying to get back, it's okay. Whatever way that you can do it, the key is to try to get your upper back to get the rounding out of it, to open up the chest, and then to get your head back a little bit.
Okay, perfect. Thank you.
You're very welcome. Okay, the next one. Does everybody have their towel roll? Pillow or a roll of paper towels? Anything. It doesn't matter. Just don't squeeze your pets. I don't want to hear any barking or yelping. So we're going to take this. Now, the significance of this is, and this is going to go back to the question about exercises that you could do seated for your lower body. So a lot of times, because your legs and your back are the two biggest muscle groups in our body, those are the ones that are going to drain the oxygen out very quickly, and they're going to produce the most carbon dioxide. So that's what's going to create the most shortness of breath. And a lot of times people will say, I can't really work on my lower body that much because of the fact that every time I do, I'm winded. So I want to give you a couple exercises that you're going to really wake up your leg muscles, but it's not going to really wipe out your breathing too much. Okay? Everybody ready? Let me see a thumbs up because I can't hear you, so at least I could see you. Excellent. All right, here's what we're going to do. I'm going to adjust the camera, tilt it a little bit. I want you to be able to see this. So the first one is going to be the seated knee pillow squeezes. So we call this our pillow or our towel, and it doesn't matter. This is what we're going to do. But we're going to break it up a little bit. We're going to alternate. We're going to throw in a couple upper body exercises too. Okay, so let me tilt this down so you can see. Okay, can everybody see this? Yes? Excellent. Okay, so basically what I want you to do is, I'm going to go to the side. I want you to sit in your chair. I want you to roll your hips forward and keep your hips forward. While your hips are forward, I want you to take this, palms up, and I want you to just squeeze this 20 times. 1, 2, 3, 4, 5. Make sure that it's out here towards your knees, not in where your thighs are, out towards the knees. And if you're doing this properly, you're going to start to feel it right here in the thigh, in the quad muscles. And then you're going to feel it up into the groin. And that's where the hip flexors are. And I'm going to explain the importance of that in a second. Everybody feeling it? Good. You might feel one side working more than the other. That's normal. If it is, try to make it even. And you'll start to feel it, like I said, in the thigh and in the groin. Now, the reason why this is important, and we're going to go back to that in a second, is your hip flexors are muscles that are down near where your pocket is front, where the leg goes into the hip socket. And those hip flexors, they connect the lower body to the upper body. So they connect in the front, but they also go through a hole in the hip and the pelvis, and they connect to your low back. And so what happens is, as they get tight and tight and tight from sitting, you're going to stand, and this is going to be forward like this. It's going to put a lot of strain back here. It's going to lead to rounding. And you could try to stand up, but if these are pulling down, it's not going to happen. So by engaging these are going to tilt, and these will get straight, and then everything will come through and across here. Okay? So that is the knee pillow squeeze. Now what we're going to do is we're going to put the towel back. We're going to put our arms out like this. We're going to relax our neck and shoulders. We're going to put our hands flat like this with our thumbs facing forward. And then don't forget to breathe on this one. And you're going to breathe in and blow out. And these are called arm circles. So you're going to start, you're going to make sure these are down, shoulder blades pinched, and keep your shoulder blades pinched throughout the whole exercise. And breathing in. Breathing is critical with this. Good. And then we stop. Check your numbers. Make sure you're okay. If you need a minute, take a minute. And then we're going to do 20 more of the pillow squeezes with the towel roll, a little quicker this time. Because these will really start to build up. And these are the same muscles in the thigh that you're using for walking, for stair climbing, for getting in and out of the shower, getting in and out of the car. It's important. So palms up. We're going to work on squeezing the towel roll again. Squeeze, 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 squeeze. And make sure the towel's all the way out by the edge of your knees. If it's in the thigh, you're not going to feel it that much. But as soon as you move it out towards the edge of your knees, you're going to definitely start to feel it in the thigh, in the groin, in the inner leg. If you ever have low back pain, this is one of the best exercises to do. This will really quickly reduce your low back pain, as long as you're rolling your hips forward off the front of the chair. If you slouch backwards, you won't engage the hip flexors that much. But if you roll your hips forward like your hips are falling off the front of the seat, then it will engage. And then last but not least, I'm going to show you, put the hands, so first the thumbs were pointed forward. Now the thumbs are going to roll backwards. And we're going to do backwards. And the circle should be about the size of dinner plates. And you're breathing and blowing, making sure that from here to here, it's one unit. So from the side view, it's this. It's not a lot of this motion. So it's this. And that, again, is going to wake up everything up here. Excellent. How's everybody feel? We good? Excellent. All right.
What was the name of the last two exercises? These extended.
These are just called arm circles, forward and reverse.
Okay.
And then the other one was the seated knee pillow squeezes with the towel roll.
Thank you.
You're very welcome.
All right.
The next one, you're going to laugh. Bill and I did this one, and it's kind of fun. It's kind of hard to do initially, but let me just readjust my camera so you could see. Like I said before, that the hip flexors play a really critical part in our posture, and posture plays a critical role in our breathing. So this next one is called the seated, isolated hip flexor lift. Okay? So seated, isolated hip flexor lift. So I'm going to tilt this down so you could see. Okay, so basically you're going to feet always nice and straight, not duck-footed, not pigeon-toed, but nice and straight, about a fist width apart. And then what you're going to do is you're going to sit towards the edge of the seat. You're going to look down and you're going to make sure that your ankles are directly below your knees. So from the side view, okay, there we go. Okay, from here. Bill, can you see my feet okay?
Perfect, David.
Okay, great. Palms up. What you're going to do is you're going to take one foot, and in this case, I'm going to raise my right heel off the ground. Keep the toe on the ground. And what you're going to do is you're going to take your left leg and you're going to come up, down, up, down, up, down. This is going to really work the leg. This is going to work the hip flexor. It's going to work the hip and the pelvis. If you don't feel it, bring the foot out a little bit more and come up here and down and here and down. After you do 15, you stop, check your feet, make sure your alignment is good, and then you switch. You raise the other heel off the ground, keeping this toe still on the ground, and then this foot up, down, up, down. And this will really get the lower body firing and those muscles working. It's really, really important. Everybody feel that? Excellent, excellent. Okay. Now, I'm going to demonstrate this exercise. I see that a lot of you are sitting, and I don't want everybody to get up and start running and trying to look for a wall. So I'm going to demonstrate this one to you. This one is called the iron cross. And this is the one that I said that we do for 1 minute. You're going to feel this throughout so many parts of your body. Okay, so I'm going to move my chair. I'm going to try to set this up. Bill, please tell me if I'm in the frame.
You're perfect, David.
Excellent, thank you. Okay, so right now, my heels are touching the wall. In the event that you have a lot of rounding, you won't be able to touch the wall. You could walk your feet out a couple of inches, making sure that your feet are perfectly straight. That really, because if the feet are open this way, it's going to affect everything from the leg to the hip to the back, all the way up. So your feet are going to be straight. You're going to relax. You're going to come back. Your butt is going to be on the wall. Your heels are going to be on the wall. You're going to bring your arms out like this, and then you're going to come back. And so the back of everything is on the wall. My head is on the wall. My arms are on the wall. And you try to hold this for 1 minute. What I want you to do is try to let your weight fall into your heels. Try to come back. And again, critical. You're breathing in with the nose. Hold and blow. And you're going to try to hold this. Fingers are spread as wide as they can be, letting everything just fall into the wall. Fall into the floor with your heels and have everything just spread. My arms aren't out here. If you have shoulder issues, bring your arms out here. It's okay. If not, then try to bring them out. You try to hold this. If you can only do 10 seconds, it's completely fine. You have to start somewhere. It's okay. Even 2 seconds, I'll take it. It's a starting off point. How is everybody?
I have a question.
Yes.
Where does the small of your back go while you're trying to press everything against the wall?
Most likely, because the majority of people have some tilt in their pelvis, the low back won't be on the wall, but that's okay.
Okay, thank you.
You're very welcome. All right. What do you say we open this up for some questions? Bill?
We're ready, David. I am hoping we have some good questions, because so far they've been great questions. And I'd like to hear from some of our members that have actually followed it along. I've noticed that Jim Ramage is into it and with it, and he was up there against the wall with that iron cross holding his house up. Congratulations.
Excellent.
So if we have some questions, let's hear them, because now's the chance to help everybody with your questions, because if you have a question, my guess is someone else has the same one.
David, this
Absolutely.
is Bill. Are these exercises that we should try to do every day, every other day? What's your recommendation?
Excellent question. The first thing I want you to think about is if you can do them every day, wonderful. The rule of thumb is if you went to do an exercise, no matter what it was, and your muscles were sore, then don't do it that day. Give it a day to rest. But if you can do it every day, because of the fact that these are predominantly stretching as well as some of them are also strengthening, you can try to do them every day, but if not, and you start to have some pain, every other day or every second or third day. One of the questions, which is excellent, and I apologize, this is my mistake. I forgot to mention this before, and I have it in big bold letters on my outline, and I still forgot to mention it. Yes. Karen wrote, is it important if we breathe in or out during raising or lowering? Yes, absolutely. So the rule of thumb is blow and lift. You always want to exhale on exertion. So if you were lifting weights, you would go pause and then breathe in and come down. And you always want to blow out and lift. Whether it be your legs, whether it be your arms, anytime you're lifting anything. If you went over to go pick up the laundry, you want to grab it and you want to blow. And as silly as this sounds, believe it or not, you even want to blow and lift when you go to stand up, because that exertion is going to elevate. Just going from sitting to standing. I have one whole we have a group of exercises. We call those menus, and I have so many menus. One of them is just a sit and stand menu, and we incorporate so many different variations of going from sitting to standing. It's an unbelievable menu. And what will happen is, just from going from sitting to standing, you're going to use oxygen and create carbon dioxide. So if you're just sitting and then you just jump right up and you go to move, your carbon dioxide is elevated, which is going to lead to shortness of breath. Now, if you blow out when you stand, you're going to reduce the likelihood of being short of breath when you go to walk. So if you're just sitting, you breathe in with the nose and you're going to blow. And then you go to walk. Now, when you're going to walk, your carbon dioxide is down here because you blew it out and got rid of it down to here, instead of standing and having it start up here, because it's only going to get worse as you walk.
David, I have 3 questions.
Perfect.
They're all kind of combined, I think. But first and foremost is, and I think you address how often to do these exercises, and how much time should they take, and where does walking fit into this equation?
That's an excellent question. So basically, you can do them every day unless there's pain. These are just basic warm-up and stretching exercises. Like I said, for our patients that I see, right now we had to, because our office closed the second week in March, and so we've been having to see everyone with video sessions. And so we meet twice a week, and what we've been doing is kind of doing some stretching and some breathing exercises and then alternating at the end. So based on that curriculum, I try to have them do the exercises, because a lot of times patients have some difficulty in walking. So we try to do the exercises that will build the foundation to make walking easier, a lot of lower body exercises. And then we try to have them walk at least 2 to 3 days a week. Even if it's just in the house for 20 feet, it doesn't matter, 10 feet. We can always increase on that, but walking is critical.
How much
it's
time,
our main
David,
mode of transportation.
If I'd looked at doing these exercises in my walking, how much time a day should I kind of plan on?
You know, that's very individual to each person. It depends on their capability. It depends on their energy level. I mean, ideally, if we could do 20 minutes a day, it would be wonderful. 20 minutes would be really, really good if we could do that. Hi, Shelley.
Oh, okay. I have a question.
Hi. Yes.
I'm the caregiver and my husband's not with me right now, but he's been doing some work for a client, and 2 solid weeks he's been bent over his computer, really not moving unless I drag him on a dog walk with me. And I'm going to get him restarted probably next week, but is this the best way to do some of these and get him, started, and then make him walk all the time every day with me? Or
yeah, I mean,
I'm a great nag. I'm great at that.
Well, the funny thing is, it's hard because we love them so much and we want to help them. And there's a fine line between motivating and driving them crazy. But I think that if you could share some of these with him and let him feel the benefit of it, then he will want to continue to do this, especially if he's spending that much time. It's going to really cumulatively really affect his posture. So we have to open everything up.
David, would you recommend these exercise bands as being good for people doing exercises at home?
Sure, as long as you're being very careful with those, and also because the problem with a lot of the bands is that you don't, as you start to stretch, the resistance increases. And a lot of times people initially, when they're finally getting used to those, they could overdo it. So just be very careful, go very slow, listen to your body. If you start to have pain, stop. Most of the time, if you're starting to have pain in your upper body, a lot of times your shoulder's out of position, no matter what upper body exercise you're doing. That's why I focused a lot on the shoulders today. So if the shoulders are down and pinched back as you're doing the exercises, it really reduces the likelihood of shoulder pain. But yes, those are good. I'm a fan of any motion.
They come in different colours, don't they? So the different
Yes.
resistance. You can start on a purple or an easier band and then work up to a green. So
Absolutely.
which is strong. I don't know in the US if that's that colours as well.
Yes, I don't believe that there's a, each manufacturer has their color coding. I think a lot of times there's no general quotient for that. But again, you can do those. You can do it without the weights. You could simply easily just do exercises without that. You could do wall push-ups. Very, very simple.
Yeah, so this sort of,
exactly. And again, with the shoulders down and back. Hold on, I'm reading one of the questions. Let's see. Isolated hip flexors, rolls hip forward, flex foot, count of 3. Yes. So you're going to blow. One of the things that I like to do with all of our patients is I like to try to have them add a hold on each exercise. So let's say they were doing lifting. So down and relax, they're blowing, hold, and then slow and controlled going down. Peter, love that shirt. Very nice. I like that. And then blowing and coming up. Let's say you did a knee raise. Same thing. So now you go to do a knee raise. You're standing and you're going to do a knee raise. You're going to come up, hold 1, 2, 3, and then down slow. Believe it or not, you get just as much benefit controlling going down as you do when you get up. So if you're blowing and then you go nice and slow coming down, you can feel the muscles working in both directions. And since you have to come down anyway, you might as well get the benefit out of it. Okay, let's see. You're very welcome. Okay, so we went over that. Field goal position, yes. Will there be videos? Yes, yes. I have my whole staff is working on trying to put all this to video. So that's what we're trying to do for everybody. So that way it would be easier. Isolated hip flexors. Yes. Can we schedule? Yes, private session. I'll go over that at the end. Like I said, what I'm going to do is for everybody who's on this call today, I'm going to give you the opportunity to have a free 15-minute consultation, whether it be phone, whether it be through Zoom or Skype or FaceTime, whatever's easier for you to answer your specific, because I'm sure everybody has their own specific questions, and then that way we could do that. Let's see. Can you talk more about the relationship? Yes, sir.
Yes, this is Ron Johnson.
Hi, Ron.
Do you recommend a roller? The large, round, stiff roller for laying on and stretching your arms out?
You can. That's if I believe what we're talking about, that helps facilitate some myofascial release. Is that what you're talking about?
It's just a long tube that's fits between your lower hip and your head, and and it's about 8 inches in diameter, and you lay down on it and stretch your arms out and move your arms up and down.
Okay. Yeah, I mean, that's what it sounds, those, from what I've used those for before in the past, was to have people lay on it and then roll back and forth on it, up and down, roll side to side. And what that's supposed to do is release some fascia, and it's supposed to facilitate getting things moving much easier. Where things would be tight, that will help loosen it. It's almost like a massage, basically.
Right.
But yes,
right.
If it feels good, absolutely.
Okay, good.
Yes.
Thank you.
You're very welcome.
Could I ask a question? Earlier, you mentioned that, I'm new to this group, so thank you, everyone. This is wonderful. Earlier, you mentioned that sometimes your heartbeat, or rather your oxygen may be normal, but your heartbeat, it could be elevated. And I've noticed that with me when sometimes I'm doing something like you said, making a batter or whatever, sometimes it doesn't seem like I'm doing that much. Oxygen fine, heartbeat high. What what's the relation there?
The relationship is a lot of times, if the oxygenation is fine, then the two questions I would want to know is it because of the fact that you're doing more exertion and you're using muscles that are weak, so we have to strengthen those muscles, and then we can reduce the heart rate doing the same motion.
Okay.
The other thing is, and that's usually an indication that it's carbon dioxide. And then the other question we would also want to know is, you know, how hard is the heart working to maintain that oxygen? You may have to temporarily bump up your oxygen a little bit when you're doing more exertional things.
I'm not on oxygen yet.
Okay. So those are type of things.
Okay, so probably the carbon dioxide. So maybe the blowing out more than.
Yes, focusing more on the exhalation, and that's important.
Okay, all right,
Yeah.
thank you.
You're very welcome. Nice to meet you. All right, let's see. Can you talk more about the relationship between something and ventilation? Mike, can you tell me specifically?
Earlier in the program, you talked about oxygenation and ventilation, that they're both
Yes, sir.
important.
Yes.
And I think what you were just saying again was, if your oxygenation is okay, but you're still having difficulty breathing, it could be because of lack of ventilation. If
Yes.
that's the case, what do you do then?
Breathe out. That's the easiest way to get rid of the carbon dioxide, is to exhale. Now, how we're going to breathe is really important. So years ago, I created my own way of how to properly breathe, and it's called flow controlled breathing, because everything in the body with the air has to do with the flow of air in and out. So we want to get that as beneficial as possible. So what I want everybody to try to do is breathe in only through your nose, because your nose naturally warms, filters, and humidifies the air that you breathe. And your lungs don't like dry, cold air. So you want to breathe in softly, a normal amount. A lot of times people will breathe in this large volume of air. A lot of times with the PF patients, as soon as they take in a larger breath, it's going to really make them cough, and we don't want to do that. So you want to breathe in just a small amount, only through the nose, hold just for a half a second, and then, now again, the old way was they talked about smelling the roses and blowing out the candles. You don't want to blow out the candles at all, because blowing is a burst. We don't want that. What we want to do is gently blow, as if you had a spoonful of really hot soup and you wanted to taste it, and you don't want to blow it all off the spoon. So you want to breathe in, hold, and then blow. In our office, we have a bunch of pinwheels that we have people blowing on to try to visually demonstrate. But the next best thing is to just take a tissue. So you're going to breathe in, hold, and blow. You don't want, and you don't want. It's one continuous breath out. So it's in, hold, and blow. And so what we found, breathing like that with this flow controlled breathing method, it's been also not only beneficial for getting the oxygen in, getting the carbon dioxide out to help with the ventilation, but it's also a very good help for anxiety. It's almost like a natural sedative. It relaxes everything in the body. Did that answer your question, Mike?
Yes, absolutely. And a lot of us have a regular exercise routine that we go through. And I do. I have walking on a treadmill, and then I do free weights, and I do some leg exercises. And
perfect.
Could you give us an idea of, if I wanted to keep doing that, some of the quick ideas about how we can incorporate what you're telling us with our regular routine, like keeping our shoulders straight and our head back and that sort of thing. Can you give us that?
Absolutely. So for every single exercise that you're going to do, we're going to break it down. So here's what we want to think about. Proper breathing, proper posture, pacing yourself, because if you go too quick, you're going to run out of breath. frequent rests to check and see how you are. We all have this in our brain. We have to get this done quick. We have to get through this. We have to push through. You don't have to. It's not the stops that count. It's the steps that you're taking to do it. And the more steps, the stronger the foundation. So anytime you're doing your exercises, straight posture. So let's say you're standing. You're going to stand. You want your feet about a fist width apart and straight. You don't want them out like this or pigeon-toed. So you want them straight. And you want to stand and try to relax, have your weight fall into your heels and just stand. Relax shoulders, shoulders lightly pinched, and then do your exercises and try to maintain that posture during the exercises. But you really want to incorporate the breathing. So it's in, hold, and blow. Now, if you're going on the treadmill, there's no way in heck you're going to be able to breathe that softly. So how hard you breathe should be equal to how much work you're doing at the time. So let's say you're just sitting, then you can breathe like that. Let's say you start walking. It's going to be a little harder. So you're going to breathe in. And you can hear the sound is louder, in. And you want to keep doing that. You go to climb stairs, all bets are off. You may have to breathe in with your mouth because it's so much harder. So posture, proper breathing, pace, all those are imperative.
You need to patent that tissue.
Believe it or not, it is. The flow controlled breathing is something, like I said, I did a long time ago, and it is trademarked and patented, so we're good. But thank you. Okay. Let me look at the hello. Hi, Sharon. How are you?
Hi. I'm in Canada, and I can't thank you guys enough for this. The exercises were great.
Thank you.
My question is, when you're saying breathe in and hold and then blow, my body kind of panics every time I hold my breath. Is that mental, or do you think?
No. I think that maybe you're holding too long. It's not an actual hold, more of a pause. So it's just in, pause, because you want the flow of air to come in. Think of 10 cars in a roller coaster. So they're going up and then they're going back. So when the first car reaches the destination, this last one's still coming up. You want the flow to go to zero and then go back, because otherwise, if you don't have the hold and you're going in and out, this is going to come up, this one's going to hit this one, and you're going to have two flows there, and you're going to trap air in your chest. So we just want to in, hold just for whatever, a brief second, even if it's a quarter of a second for you, and then gently.
Thank you.
It takes practice. You're very welcome. It takes practice, but it will get easier, I promise.
David, I've had a few people ask me, if people want to contact you, can you share? We're going to have
Absolutely.
it on our recorded. This webinar has been recorded. It will be on our website in our Facebook private group. But
yes,
how do they contact you? What's your phone number, and what is your email address? Because you're giving us this generous, wonderful offer of a 15-minute private consultation, and it's going to answer a lot of the questions that aren't being asked here. But how do we get hold of you?
I'm glad that you asked. Hold on. And first of all, ladies and gentlemen, please thank Bill. None of this would have been possible without Bill. Bill contacted me. Bill asked me to help, which I'm so happy and honored for the ability to try to help all of you. But this is really Bill, so please make sure that you thank him. And he also taught me how to go through this and also how to set up my lighting and everything, because, you know, I'm a clinician. I don't know how to do all this stuff, but I'm slowly learning. So thank you. And hold on, I will share my screen. And I believe, can everybody see that?
Perfect, David.
So that is how you get a hold of me. My last name is spelled Junga, and it's pronounced like the J is a Y. It's Junga. So David Junga. That is our website, pulmonaryrehab.com. There you'll see, we have a blog. You'll see some of the interesting things that we talked about. And I'll leave this on the screen for a little while so that if people would like to do that. But if anybody has any other questions, by all means, please let me know.
You just answered a big question for me, David. How to pronounce your last name. Thank you.
You're very welcome.
Hello, David. This is Nick from England again.
Well, hello, Nick. How can I help you?
Oh, well, thank you. Firstly, I'd seen or done most of your exercises before. Interestingly, I'd never seen the iron cross. My office is in the roof, so my roof is not straight, it's pitched. But I managed to stand forward a bit. And I managed to do most of your exercises despite my tumble down the stairs this afternoon. Does the 15 minutes still apply to me, even though I'm in England, is my question. And if it does, my partner, I would like, my partner's quite private. She knows I'm doing this afternoon. But I'd quite like her to join, and maybe you give a very brief synopsis of what you talked about this afternoon, specifically around the breathing and the exercises, because, well, she's very good at encouraging me, and I do a lot of exercise. Some of those, as I'd said, I've seen before, but I'm guessing info@pulmonaryrehab.com is what I need to email you to set this up. Is that correct?
Yes, that's. I'm glad you mentioned that. For everybody who attended today, all I want you to do is email me at info@pulmonaryrehab.com, and then in the subject, just put PF Warrior. And that way, I have everybody instructed that when that comes in, that immediately gets forwarded directly to me.
Thank you so much.
You're very welcome. Did everybody have a chance to write down or take a picture or a screenshot of everything what this is? Are we good?
We are, David, and this, of course, will be in our video as well. And I have to thank you one more time for your time, your generosity, and the information was so professional and well done and insightful. And I know I'm walking away with new, fresh ideas that are going to help me. And we appreciate what you're doing for us. Thank you.
Thank you. You're very welcome. It is my pleasure. I'm so grateful for the opportunity to do this to help everybody. And if you'd like to do this again, I mean, I literally probably have, I'm going to say probably close to 200 exercises. I just did the very easy ones first because I wanted to make sure that everyone could participate, everyone could feel some benefit. And if you'd like to do this again, then I'll come up with some other exercises that we can do. And again, I want to do it where you're in the comfort of your home with limited activity or anything. So
we'd love to do it again. And I had somebody else ask me if you could provide I guess kind of a written cheat sheet of the exercises we can share. We'll put it on our website.
You know, the funny thing is, I don't even, I'll have to have my staff start working on it. I don't have any of that because right now the focus is more on, when we do it with everybody, because I watch everybody like a hawk. I want to watch their posture. I want to watch their breathing. I want to do this. And unless I watch people do it and do it well and do it safely and productively, I usually don't give out any sheets until I do, because otherwise they're going to do it all wrong. And then we have to unteach what we...
You can put it in your book. When you write a book.
Yes. Right now we're working on a video series for everybody. That's what I'm working on right now. Good. So it'll be good. It'll have, I think it has 5 menus in it, from sitting to standing to aerobic to, I mean, we have an aerobic exercise. I'm not going to have everybody do it today because it's really challenging, but literally you could do it in 30 seconds on standing on each foot, leaning forward, and you'll get the benefit of about 20 minutes on a treadmill. You really feel it. So it's good. But okay, does anybody have any last questions before we go?
I have a statement. This is Margaret Liebig, and I am a group leader in New Jersey. And I do have some printed exercises, which I will send to you on info so that you can see what I have that I've given to my group. And I want to thank Bill for putting this together. Thank you. It's very, very informative. And I will contact you. Thank you.
Thank you very much.
Thank you, Margaret.
Ladies and gentlemen, thank you so much. It's been my